Welcome back. Today we'll be discussing the use of MRIs in the management of lower back pain. In particular, I'm going to be covering 5 reasons why, in most cases of lower back pain, a MRI is not needed, and how actually relying on the findings of an MRI can actually damage patient expectations and lead to worse outcomes for that patient in particular. So let's strap in and get started. One of the primary reasons why a person with lower back pain would want an MRI, or a doctor might prescribe an MRI, is because they want to know the cause of their lower back pain. So again, especially in adults, a lot of times this lower back pain, it comes on gradually. There's not one specific incident that they can point to that is the cause of their lower back pain. They probably tried a couple therapies and the back pain is still hanging around and they're wondering why. And they hope that if they get the MRI will show them the cause of their back pain so that they can then find the best treatment. But unfortunately, the reality is that MRI does not show you the cause. The findings are completely incidental, meaning that things like disc bulges, arthritis, disc degeneration, these are all normal parts of the aging process, and that they can be found in people with lower back pain and people without lower back pain. So the first thing we have to understand when you're going in to get an MRI for lower back pain is that the image findings are incidental and they will not show you the cause of your lower back pain. The second reason why you don't need an MRI for the management of lower back pain is that it's not going to change the treatment. So there's this unwritten rule in medicine that you don't really need to order a test or any sort of imaging unless it's going to change the course of your treatment plan. So for example, you might order an X-ray on an area that has some pain if you suspect a fracture, because you're going to treat a fracture very differently than you're going to treat a sprain or strain. So that would be a case where you do want to order imaging just to rule out something. But in the cases of an MRI for lower back pain, the findings of that MRI are not going to change the treatment. So again, most cases of lower back pain are going to be best managed conservatively through chiropractic care, massage, acupuncture, conservative therapies, combined with exercises to limit impact that goes through your joints. So that's physical therapy, that's movement training, strength training. That's going to be the best treatment for most cases of lower back pain. And the MRI, the findings of an MRI aren't going to change that. And so it's not really required to spend the time and the money on an MRI if the treatment is going to be the same at the end of the day. Another reason why we have to be careful with the use of MRIs in the management of lower back pain is a lot of times these findings are used to justify an unnecessary, expensive, and oftentimes dangerous surgery. So we got to be very clear is that most cases of lower back pain do not require surgery to get better. But the traditional medical model doesn't have a lot of answers for lower back pain. So after the normal things don't work, the pills or the injections, a lot of times they'll order an MRI. They'll see things like the disc bulges or disc degeneration or arthritis and use that as a justification to go in there and start on surgery. And this becomes a problem because usually it's not required. Again, most cases of lower back pain are going to recover on their own without the expensive surgery. But also, surgery can cause a whole other host of problems. Again, you got to cut through muscles, nerves, tendon, ligaments to get into that, which can cause a whole host of issues. The long recovery can change the way you move and lead to the pain coming back. In fact, they've actually done studies that the long-term effectiveness of surgery in the management of lower back pain is just the same as if you didn't get the surgery in the first place. So it's really important that we don't use the MRI as a justification to go into an unnecessary surgery. Another reason why you don't want an MRI for the management of lower back pain is because it's expensive. So just do a quick Google search of lower back or lumbar MRI in your area. I did it in mine, and the cheapest I could find was $600, just depending, but the cost went all the way up to $2,000 or $3,000. So knowing now that an MRI is not going to show you the cause of your lower back pain, it's not really going to change the treatment of lower back pain. What if you invested that money working with a back pain specialist to get you out of pain faster and more effectively than pills, injections, or surgery. So that's reason number 4, is that MRIs are just really expensive, and because they don't provide that much useful information, we don't need them in the management of lower back pain. Most importantly, the use of MRIs in the management of lower back pain has been shown not to improve patient outcomes. So the medical guidelines have been clear on this for quite a while, that MRIs don't do anything to decrease lower back pain, improve patient function, or improve their quality of life. And really, when it comes to a treatment plan to solve lower back pain, those are the things that are most important. So if an MRI is not going to help you decrease pain, not going to improve your function, not going to improve the quality of life, let's focus on the things that do that, which again, in my biased opinion, it's going to be movement, strength, combined with conservative therapies to get you out of pain. So that's all I got for you today. Again, one of the goals of my page is to help you make better decisions for your health. Again, I understand the medical world can be very confusing. There's a lot of opinions. There's a lot of different things that you can try. And I hope that the information that I provide in these videos is giving you information so that you can make the best decision for yourself. So if you do have any questions, please don't hesitate to leave them in the comments below. I do read them all and I will respond. I want to thank you one more time for being here. My name is Dr. Carl Baird, and thanks again. We'll talk to you soon. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.